BPD unmasking. What happens when you stop hiding? Have you ever felt like you were holding it together for so long? You were smiling, staying quiet, you're just pushing through, but lately it feels like it's slipping. Well, you're not broken, first and foremost. You might be unmasking. Now, we're going to explore what that means and why it's an actual sign of healing in this video. So stick with me, and here we go. So what is masking in BPD? Masking is that you are hiding your emotional struggles to appear normal, to appear like everybody else. And this is actually common in individuals with quiet BPD or even what's called internalized BPD. And what that is that individuals with BPD, they're able to stuff it inside. So all of those maladaptive beliefs, behaviors, and patterns, a lot of times they come out in fantasy, but they don't come out in behavior. And what happens is it's more of a very passive approach to life. In some ways, it could even be a passive aggressive approach to life. Now, examples could be that you suppress anger to avoid conflict, that you're smiling in public, but self-harming in private, or even overachieving while you're continually feeling empty inside. And an additional example could be you're the easygoing one to everyone else, but inside you feel like you're drowning, like all of this internal pressure. You're trying to keep it all down and you're trying to manage it all. Just like a common example that I give in a lot of my videos is that it's like this giant pasta pot, right? That's on the stove. And every time that you have to stuff it, it's like pouring more water into the pasta pot, right? You keep pouring more water. And your BPD and family in the head. Now, family in the head, that's that chorus in your brain that amplifies the borderline personality disorder, BPD, beliefs, behaviors, and patterns. And it drives you to act out. It pushes you in that direction. It doesn't mean that you're not responsible for your behavior, but you have this internal push that becomes so intense. So it's like putting a lid on that pasta pot that's boiling because your BPD and family in the head has turned up the heat. So it's really boiling. You put the lid on it and it starts to, shimmy and shake, right? From all that pressure. And that's what happens is that you're trying to mask it. And unmasking happens just like the pasta pot. You get emotional overload, which makes the mask hard or feeling like it's impossible to maintain. Therapy or supportive relationships, typically they're going to encourage openness, exploring this, but you could have a fear that if I open the floodgates, I'm going to drown. And it's also about processing past trauma and the emotions that come with it. And that's why coping strategies are so critical. So it's more than just talking about the trauma. How do you cope and manage with those manifestations, with what I call surface content, when you get to the trauma underneath, the trauma that's driving it? Perhaps it was the inability to connect to others. Perhaps it's feeling empty. Perhaps it's feeling isolated, that's part of your mask. So pulling it off is that then you start to embrace some of those thoughts and feelings and the emotions behind it. And personal growth through that can invite authenticity. Let me give you an example. As you begin therapy and suddenly old memories or buried feelings start to bubble up unexpectedly, and you might get a little nervous, a little scared, be like, oh, I don't want to do this. Therapy's terrible. I don't want to do all that. That's where the coping strategies come in. That's where the therapeutic alliance comes in. Hopefully, your mental health provider can be like, look, I got you. We're going to get you through this. I totally got it. I know with a lot of my clients, when we start working on past patterns and issues and how they're manifesting today, it scares them immensely. And I totally get it. And I tell them, I got you. And the reason why I've got them is because I've done this before. I believe that I can help them. I really do. And I am on their side against BPD and family in the head so that they can embrace a healthier outcome. Now, when you unmask, it can be this intense emotions that trigger feeling unfamiliar or unsafe. So you feel different. It feels different inside. And that's that pull back to BPD and family in the head. Because a lot of times, personality disorders are created out of prolonged maladaptive beliefs, behaviors, and patterns. And because they're so prolonged, we end up developing these comfort zones. Comfort zones don't mean healthy. Comfort zone means it's what you're comfortable with, even when it's maladaptive. So when you start to unmask, there's intense emotional triggers. Things can feel unfamiliar. You can be like, who is this person inside of me? It feels strange. It feels weird. That can be very normal and part of the process. Internal identity confusion can come up. Who am I without the mask? And then emotional expressions. These may surprise even you because you may feel different things. Anger towards a parent or a sibling or someone who on the surface you were like, nope, they're good. Nope, they're cool. Nope, they're cool. And in many ways, you were almost like gaslighting yourself to believe that someone who you can't count on, someone who keeps threatening you with abandonment, somebody who is inconsistent in your life, but yet they make you feel bad for it, you may start to realize, wait a minute, that person's not so dependable. They're not so stable. They're not so nice. And that can kind of surprise you because there's a lot of emotions that's attached to that as well. And then, of course, relationship dynamics, when you're going through this, these can shift or even cause the relationship to feel strained. And if it was strained prior to this, because there were moments where the mask would slip off, BPD or maladaptive beliefs, behaviors, and patterns were sneaking out. So you may already be in a strained relationship. So now when you're unmasking and without the right sort of guardrails, protective factors in place, it can really make that strained relationship feel even more strained. For example, you express hurt for the first time, and that person tells you, you've changed, because they expect the masked presentation. And that's not the real you. So you've been hiding all of those fears, doubts, shame, insecurity, fear of abandonment, rejection sensitivity, that emptiness inside. And then when you start to mention it, people are like, what? I didn't expect that about you. What? So then you feel bad, and then that makes you put the mask back on. And that can create a lot of fear and risk in unmasking. And it's a fear of being seen as too much, or the shame about not matching others' expectations and thinking that if I do that, then they'll reject me. I'll lose those friendships. I'll lose those relationships. Or my therapist will refuse to see me. I've had that too. I've had people say, if I tell you this, I don't think, you'll want to work with me anymore. And I've never heard anything that has made me not want to work with someone anymore because I recognize the pain that's involved in doing this. I recognize that. And emotional regressions or meltdowns can come with it as well because you feel like if I let a little out, there's going to be a tsunami to follow and I'll lose control and I'll go crazy. I'll lose my mind. But it's important to realize these are normal feelings when you're unmasking, and they are not signs of failure. That is important. To give you an example, you finally speak up for yourself, and then you feel guilt, panic, and wonder if it was a mistake. That's that push or pull back to that unhealthy comfort zone that we just talked about. That adds to the fear and intensifies the perceived risk of unmasking. But if you live your life masked, you miss out on the real textures of life, the real connections that you can have in life. BPD is the most successfully treated personality disorder. 85% of individuals with BPD experience remissions. That's huge. More people need to be talking about that. And there are benefits to unmasking. It increases self-awareness, enhances emotional clarity. You feel healthier and you have more healthy, honest connections. better regulation through real expressions. In other words, you're turning down the heat on that pasta pot so you can cover it and it's cool because it's not bouncing off, right? And you're taking some of the water out. Now you're scooping the water out. So there isn't as much water. You're turning down the heat and you can cover it all you want. You could even take the pot off the stove, clean it up, let it dry, and put it away in the cabinet. Really went far with that example. But also, unmasking can give you a stronger sense of identity and boundaries, and that's critical. For example, you set a boundary and initially it feels kind of shaky, but you're proud of yourself. Someone respects it and that changes how you see yourself. But just because someone else respected it or they didn't doesn't mean that the boundary is right or wrong. Go with your internal metric, your internal identifier. That's where the real power is. That's where the real sense of understanding is. So I want to tell you, how can you unmask safely? Okay. So unmasking doesn't mean that you're exposing everything, right? You're not purposely, just you're breaking down the dam and everything's just going to come rushing out. That's not what it means. It means practicing honesty in ways that protect your emotional safety. First, what I want you to do, now we're going to do 5 things. First, number 1, try saying, I'm not okay today, or that actually upset me. Recognize the negative emotions in yourself. You don't need the mask that everything's fine, don't worry, everything's fine, don't worry, everything's fine, don't worry. No, start small by just saying, I'm not okay today, by having a bad day, and it's okay to have a bad day. Or if somebody does something that hurts your feelings, it's okay in an appropriate manner to say, that actually upset me, that kind of hurt my feelings. And then choose safe people to open up with. Now that's number 2. Choosing those safe people. And you want to open up around those who listen without judgment or pressure. Those are the healthy others that I want you to surround yourself with. Don't surround yourself with unpredictable, sometimes emotionally helpful, sometimes emotionally punitive individuals. That's not what we want. And use therapy as a practice ground. Let it be a space where you can try and say things that are hard. Try and practice with your therapist, your mental health provider, about saying things that maybe ignite a lot of emotion in you. Therapy is the safe space to do that because your therapist should know how to handle it. I'm telling you, they got you. I hope they do. That's my hope for you. And number 4, plan for aftercare. This means journaling, grounding, or what type of music can help process the vulnerability hangover. A vulnerability hangover means that you were honest up front, you did it in an appropriate way, but BPD and family in the head's pushing you back, right? They're pulling you back into that unhealthy comfort zone. So you're going to get pulled into that. And then because of that vulnerability, right, that you were honest, you unmasked yourself, you're going to feel exposed. You're going to feel like, oh, I did something wrong. Something's not right. You're a bad person. You did this, you did that. That's turning it on yourself. Don't turn it on yourself. That's why the journaling, grounding, music is so important. Grounding is when you can utilize a strategy, could be mindfulness, could be meditation, could be something tactile, could be something olfactory, right? I've got a little, some Caribbean Escape, it's called. It's some essential oils. Smells very nice. And that can help you ground too. Brings you, oh, it's on my finger. See, and it kind of brings you to the moment. It keeps you very present. Because what's going to happen, that vulnerability is going to trick you and push you back into that unhealthy comfort zone. That's not what we want. Last, expect setbacks. Completely normal. It's okay to step back, regroup, and then try again. It's okay. Just never give up on yourself. Never, 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 never. When should you give up on yourself? Never. Let me give you an example. Is that when you usually minimize your pain, this time you tell a friend that you're struggling. They don't fix it. They just sit with you. They just listen. That moment feels real. In another instance, as another example, in therapy, you admit you feel needy and that you really hate that. And your therapist responds gently. And it's the first time you don't feel ashamed for needing support. And that's so important. It's okay to need help from other people. It's okay to ask for help from other people. Unmasking is hard, but it's healing. You're not falling apart, you're falling into who you really are. And yeah, it's scary, but it's also part of being seen, known, and maybe even loved for real and for who you are. So I hope you enjoyed the video. Leave some comments. Tell me about your experiences with unmasking or even wearing that mask and why you wear it. So leave that in the comments if you're comfortable doing so. And I hope you enjoyed the video, and I will see you next time. Bye-bye.